facial sculpting because here's a guy that already looks good and we're gonna do enhancement. See, with fillers, years ago, it was made to give volume and fill lines. What we're using fillers now for is sculpting and contouring of the face, enhancement and prevention of aging. So here's an example of a younger guy who has already somewhat of a defined jawline and chin, but has a lot of this area that's kind of coming down from weight loss, some volume loss up here. And we're just trying to give him kind of enhancement, all those features. He likes that striking Model S look where it's more contoured, where it's defined down the jawline, where it's more bold in the chin, and where this area of his face is a little more elevated so he doesn't notice hollowing and drooping. So we're gonna focus on that today for him, and you guys will see it's gonna be pretty dramatic. We already did a teeny bit into the temple, and now we're doing a little into the chin. We're using Radius that tends to, I find, be one of the more well-placed sculpting fillers. And it's good because it can go on bone. And you see a pretty dramatic change in a very small amount, which is why I like it a lot. I always like to start on sort of the thirds of the face. So we did temple slightly. I might do a little bit more, but I just want to do his jawline and everything first because we want to utilize the amount we have to get him the results that he wants. And in this placement, we're creating a foundation. We're doing it straight on bone to really build. And I'm going to show you guys another cool technique in a second. But like, look already, come to the 90 degrees. Come over here. I think you should go that way, probably. Look at his nose, lip, chin. Look at that ratio. That shows a very significant change in imbalancing. It's really good. That's a good result. Now what I want to do, where did the cannula go? Okay, so now what we're gonna do is create a little bit more, I'm gonna turn this way a little bit. We're gonna create a little bit more shaping from the chin to jawline by using a cannula. Now, I was one of the first doctors to do this online years ago. And lately, I've kind of come back to it a little bit more because it allows me to give this, and on him specifically, you'll see a lot more bold sort of definition. And it's really gonna define his neck and jawline if we do this. So we're gonna use, not too much, just a little to kind of just build that out, okay? We're gonna go to the other side. And the good thing about this cannula is it limits pain and bruising and swelling. We're gonna do it in two places. I'll show you guys. But this is gonna be dramatic. They're gonna love it. Is anyone saying anything or?
How much is this procedure? It really depends on the number of syringes that you...
Yeah, the number of syringes, the type of syringes, who's doing it. Remember in New York, we have Ashley. Here we have myself, Rosa, and soon Melissa.
Let's talk a little bit why it's so important to see an expert provider like you for this procedure.
Well, you guys know there's so many people nowadays that are using these fillers and don't understand anatomy, which can, worsen or increase the risk of complications. As well, though, honestly, it's a little bit of artistry because, especially a young guy, you do not want it to be noticeable at all. So he had said to me, I want this like V, right? Now look, just with the chin, he already has it. Like it's already defined that way. So that's why we do that technique. Projection with a little bit of elevation laterally. All right, turn this way now. There. So he already has bulk. So what we want to do is give him a little bit more shaping. It'll give him some size. You don't want to overdo the lower third, but he wants a little bit more definition, so why not? So we're gonna feel for the back of the jaw. We're gonna go right there and sort of define it out a little bit.
Some people that are just joining want to know, is it painful?
No, not at all.
It looks weird, it looks crazy because we're doing this and I have to push real hard. Remember, the cannula tends to be in an area where there's hair follicles, a little bit. So it tends to kind of, irritate a little bit.
Just a little pinch.
A little pinch here or there, but there's numbing inside. Mm-hmm. And you don't really feel it too much.
Can't wait to see the result.
Can you see the front? Oh yeah, that already looks good. Okay, turn this way again, towards me. It's okay, I think we'll be all right.
And yes, we are using filler. We're using radius.
And why do we use radius? Because one, hold on. I'll give me that back. So, hold on, those spots are closing up. Because one, it lasts a very long time on guys that are athletic and that work out. It also gives a little bit more of a sculpting and contouring look, which is what we're going for him, especially at this 90-degree angle. I'm trying to define it a lot. You guys will see in a second. There we go. You see it forming right there? There. Okay. So now, that's one side. And he's gonna turn, no, I see on this side. He's gonna turn your head left now. Perfect, give me that needle again. So the goal is we really want this part to pop out. And so we wanna build out, go ahead, the structure right at the angle of the mandible, right here. And really define it, see? So look. There we go.
Can you combine this with other treatments?
Yeah, we're gonna do threads today. You can do lasers at the same time if you wanted. His goal was the sculpting and sort of tightening of the face, so this is what we're doing. Why not?
Someone wants to know, does this work also on older men?
Depends on the face, but the answer is yes. Everybody has lost volume as they get older, right? So it's not an age thing, it's more of an anatomy. It's more of an anatomy thing. So if you have a lot of looseness in your skin, you may need tightening more than you would need this. That's actually one of the things him and I talked about. For him, what I wanted to do after he's built this foundation is to continue to tighten the area because it's gonna keep it sculpted with something like soft wave, for example, or oral therapy or microneedling radio frequency. Perfect. So let's just show it from the front so people can see right now. Take a look. Looks amazing. Don't show him. Don't show him yet.
Not yet.
He's not allowed to see it. I still want to do a teeny bit more onto chin. It should be actually pretty numb, which is why I came back later. You might feel a little bit, but shouldn't be too bad.
Someone wants to know, is radius better than Voluma for cheeks?
It's a good question. I like Voluma as a softer look. I like Radius as a harder look for somebody that wants more definition. It's not that it's better or worse. It's just Voluma is reversible and Radius is not. Great. All right, so now I want to show you guys something. So we're going to finish here. I'll do a little bit more at the upper part of the temple as well, but right here is where his cheek fat pad is, you see? And someone his age should actually be up here. So part of what we're gonna do is lift it slightly by elevating it with filler as a foundation. Not too much, but just a little, just enough that'll make his cheekbone sort of pop. Then also we're gonna do threads. Threads build collagen and they help fix the tissue in a new position. Yeah, honestly, this is gonna be literally incredible. He's gonna love it. All right, I can tell. He has a really great smile, so we need to enhance that smile with the contours, honestly. And the thing is, the key is just to make it not look overdone at all. But like I said, the cheek tends to be a little bit more swollen at first, and if you don't do it that way, where it's like not overdone, but it's just, there's more there than you would anticipate initially, then you don't see a long-term result that stays. Hold right here, I'm gonna go to the other side. Okay. Almost there, you guys.
Go ahead.
And then we do an Emer reveal. It's gonna be great.
You could take a chicken nugget if you want.
Okay. Perfect. Okay, so now again, same thing. You guys see this crease here and a little fold there. So what we're gonna do is elevate the tissue slightly, and again, I guess really small amounts. You don't wanna overdo the amount here. Radius tends to swell a little bit more than the tissues, and we're creating more of a what's called a horizontal approach or a vertical vector, because that gives a more natural masculine look versus one that's feminine. We do not want to elevate, you do not want to elevate his cheekbones too much laterally.
Dr. Emer, there's a lot of talk right now about undetectable aesthetics on social media.
Oh yeah.
Let's talk a little bit about that in male procedures specifically.
Well, that's what him and I just talked about. He specifically, men do not want to look like they had anything done. And one of the things he was talking about was he wanted a very natural look, but he likes a more sculpted look. So to create a more sculpted look that's natural, it needs to be, again, done with the right precision, with the right technique. And that's, honestly, that's more of the person injecting than it is the actual filler. And so again, what he wants on here is more of that sort of 90-degree angle line. Now here's the thing, so I just to teach you guys as well, he naturally has a big muscle here too, and the tendency would be to actually Botox that muscle and shrink it. But that is not what we give a guy a masculine look. So we're using the filler to contour it, not overly size it. Turn it that way. Just gonna do a teeny little bit extra here, and then we're done, because I only want just a little peak, not too much.
Someone said this is the best work I've ever seen.
Amazing. Well, you guys should check out, I want it to be, but you guys should check out what we did in New York recently, because those were incredible too. Just gets better and better, you guys, when you've done this for this many years. So again, just outlining slightly. There we go. And we're almost finished. And then again, one of the things I talked to him about is guys' faces. I used to lecture a lot on different ethnicities and different races and faces. So there's often the 90-degree angle, and there's this little space, which is why I elevated here. What I'm gonna do for him, just a little bit, just slightly improve this line, just a little. You don't wanna overdo it, because I really want it just to look, if you look from the side, now, look at how straight that is. And then what I'm gonna do is a little bit at the high point of the temple, give a little bit more balancing, because otherwise the entire lower part of the temple is filled, but not this upper portion of the temple. And then we're done.
Someone wants to know how many total syringes did we use today?
We did 3, 4, 5, 6, 7, 8. 8 syringes. So on average, most true like male facial sculpting for all these areas, it takes at least that much. But again, it depends on what his starting point was actually pretty defined. Oh wow, that's a bomb. Oh,
So good.
I'm getting
Okay,
excited.
supermodel. We got a model here. All right, so here we're gonna do, this is what we're gonna do. We're gonna do a Emer reveal. How do we do it? You're gonna take the phone, stay 45 degrees, look at your face, we're gonna shine the light, and then we're gonna give you also here, don't look down. Look
Oh
up.
my
Okay,
goodness.
so look at this. Look at
This is
look at
exactly what I
There,
wanted.
hold on, go down a little bit, down a little bit. Right there. Now take a look.
Oh my
Slowly
gosh.
turn to one side. Yep, there you go. What do you think?
Oh my, this is exactly what I wanted.
So what was your goal?
A more sculpted, chiseled look, exactly like this. This is how I envisioned it in the mirror every day.
It's amazing.
Thank you.
So here's the key.
Oh my gosh.
Let me teach this. A little bit of height, but it doesn't look artificial like feminine, because feminine
No.
comes out laterally and high.
I look like a model.
So I know, I told you.
Oh my gosh.
Temple, and then again, you already had width. We just needed to kind of straighten it, right? Bring it out, bring it down, and then what we did here was brought it forward wider and then kind of up a little bit, so you have a little bit more of an angle, so that it gives you more of that sculpting. One of the things we talked about later was if you truly wanted more, we could bring this in slightly by doing a buccal fat pad reduction or even heat the neck. We're gonna try threads though first. So bring it down a little bit, turn the side again so people can see different angles. Take a look at the height, look the other way.
Oh my gosh.
Take a look at the height.
Oh, this is
All right,
insane.
now. No, that one, no. Now we're gonna give you the real mirror so you can
It's
see it.
dangerous, doctor.
I know it is, but at least he goes to a doctor that will not let him overdo it. So here again, hold 45 degrees straight. What do you think? Light.
Oh my gosh,
Yeah, shine that light.
this is incredible.
All right, so sculpted and defined. That is super masculine male facial sculpting. To do this right, you need to be symmetrical in every third, which is what we talked about and why he was able to do all those areas. So let them pan, just sit lightly back, just sit there, let him pan a little bit.
And it's a little swollen right now, right?
Yeah,
so this is not
it'll
necessarily
kind of blend in and go down
yeah.
probably like 20%, but
The cheeks are a little up right now, but it's still like the
yeah,
jawline
to
is
be honest, it actually
incredible.
looks really good.
Wow. This exceeded my expectations actually. I thought it was just gonna be like a minor.